So good day everyone. So this video will talk about type of woods. Number 2, first aid for open woods. Number 3, type of shock. Number 4, first aid for shock. Number 5, animal bites. Number 6, first aid for snake bites. Number 7, first aid for snake bites. So first we will talk about type of woods. So type of woods: abrasion, burns, laceration, avulsion, pressure ulcer, and gunshot wounds. So number 2 question, first aid for open wounds. So first step we will do is control bleeding. Next, use a clean towel to apply light pressure to the area until bleeding stops. This may take a few minutes. Be aware that some medicines will affect bleeding and may need pressure to be applied for a longer period of time. So next, wash your hand well. Next, prior to clean or dressing the wounds, ensure your hands are washed to prevent contamination and infection of the wounds. Next, rinse the wounds. Next, gently rinse the wound with clean, lukewarm water to cleanse and remove any fragment of dirt. So next, dry the wound. Next, gently pat dry the surrounding skin with a clean pad or towel. So next, replace any skin flaps if possible. Next, if there is a skin flap and it is still attached, gently reposition the skin flap back over the wound as much as possible using a moist cotton bud or pad. So next, cover the wound. Next, use the non-stick or gentle dressing and lightly bandage in place. So number 3 question is type of shock. So these are the type of shock. Septic shock caused by bacteria. Number 2, anaphylactic shock caused by hypersensitivity or allergic reaction. Number 3, cardio shock from heart damage. Number 4, hypovolemic shock from blood or fluid loss. And lastly, neurogenic shock from spinal cord trauma. So that are the type of shock. So first aid, number 4, first aid for shock. So first step we will do is lay the person down and elevate the legs and feet slightly unless you think this may cause pain or further injury. So next step we will do is keep the person still and don't move him or her unless necessary. So if the person is showing no signs of life, we will do a CPR. So next we will do is loosen, tight, clutching, and if needed, cover the person with a blanket to prevent chilling. So we will use the uh, blanket. So next step we will do is don't let the person eat or drink anything. So next we will do is if the person is bleeding, hold pressure over the bleeding area using towel or sheet. So last we will do is if the person vomits or begins bleeding from the mouth and no spinal injury is suspected, turn him or her onto a side to prevent choking. So number 5 question is animal bites. So usually animal bites, scratches that break the skin can sometimes cause infection. Some bites need stitches while others heal on that their own. Rarely bites from wild animals can lead the rabies, a life-threatening infection. So next question is first aid for snake bites. So first step we will do is move beyond the snake's striking distance. Next, remain still and calm to help slow the spread of venom. Next, remove jewelry and tight clothing before you start swell. Next, position yourself if possible so that the bite is at or below the level of your heart. So last step we will do is clean the wounds with soap and water, cover it a clean, dry or dressing. So last question is first aid for dog bites. So these are the first aid we will do. So first, wash the wood with soap and warm water. So gently press a clean cloth over the wood to stop the flow of blood. So next, apply an antibacterial ointment to the wound. So next, cover with a sterile bandage. So next step, watch for signs of infection. So seek help if you suspected infection or possible exposure to rabies or if the wound is severe.